Hi, my name is Michelle Benetsky. I'm a nursing student at Purdue Cal. We're here today to do an interview on patient safety in the operating room for my communications class. So I'd like to welcome Julia Palicki.
Hello.
Hi. And why don't we start by you telling us a little bit about yourself?
Michelle, I've been a nurse for 22 years. I started out in extended care. After about 2 years there, I came to the hospital, and I've been here since then. I've been in the operating room services department for 10 years now. That's varied between pre-op, post-op, helping a little in the OR, and my current job.
Great. So let's talk about one issue that we do hear about is wrong site surgeries. So what safety practices do you use to prevent that?
There's a whole gamut of things that we do to help prevent wrong site surgeries. Some of that is timeout, some of it has to do with medication safety, some has to do with positioning, some has to do with counting. What is very specific you'd like to talk about?
How do you prevent the wrong site?
Probably the first thing to prevent a wrong site surgery is really verification of the surgical procedure schedule. That happens throughout the stay of the patient. When the patient gets scheduled for surgery, the surgeon will call and say, I want to do whatever it is for the patient. And that starts a process within the hospital while the patient's at home even. The pre-admit nurse calls the patient and starts doing what we call an intake assessment on the patient. We ask some history questions. We verify with the patient at that time that Dr. Smith has you on the schedule to have this surgery done. That's the first step of contact between the hospital and the patient, verifying that they know what's happening. The second step would be when they actually come to the hospital the day of the surgery. When they get admitted to the hospital by the pre-op nurse, then the pre-op nurse is going to ask, let's say you're Mr. Smith. They're going to say, Mr. Smith, can you tell me your birthday? And we verify that you're who you say you are. And then we're going to ask you to tell me, in your words, what your surgeon is doing today. And that is to verify that you actually understand what they're doing and that we are on the same page, that we have you scheduled for what you think is having done and that you understand what is having done. So that's the first thing of whether or not the patient understands their surgery. That's all verified, before surgery. It goes a step further when the surgical nurse meets the patient. She reviews that with the nurse that just assessed them and verified it, and with the patient again, that patient is on the same page. Once the patient comes to the surgery room, we do that again. We have a WHO checklist that they review in the operating room. And when we do this checklist, it's verifying the patients who we think the patient is scheduled for the surgery. The surgery is, everybody's in agreement with what's being done for the patient. If there's a site, a left versus right, upper body, lower body, trunk, back, then that's verified. All of that's done before any kind of incisions are made when we do a timeout. So there's several timeouts, you could say, for the patient before we do a surgery.
Great. Now, we also hear about retained foreign bodies. What practices do you use to prevent that from happening to our patients?
Well, that process, interestingly, you hear a lot of we do a lot before the patient even gets to the procedure room. That starts before the surgery also. We start by counting our instruments and counting our supplies, sponges that we use for the patient. That's done between the operating room nurse and the surgery tech so that we know that we went into the room with 10 instruments and 5 sponges, just to simplify it. We'll count that. We have technology that we scan the sponges also, so that will have a backup electronic documentation of what we started with. When the case gets done, before the surgeon starts to do any closure, then we're going to verify that count is the same as what it was when we started.
Is there any time that those counts are incorrect?
And there can be times that those counts are incorrect. And we have processes in place to find them, if it's a missing instrument, or to find out where it went. A little bit of that is that we'll search the room first. Did something fall on the floor? Did something get thrown in the trash? If that's not the case, we'll call in extra help. Like we'll call out to the surgery desk and ask for a manager or supervisor to come in. And sometimes that's helpful because at this point you've got a patient on the table and you're wondering what happened, where is it, what could have gone wrong, and that causes anxiety in the room. And just having the extra support to come in, they're going to do the same thing. And they're going to look on your field, they're going to look under the bed, they're going to look under the table, they're going to look in the trash. And they may find it. It may have been something that got thrown with something else, and there you are, there's your missing supply.
So So, tell me a little about medications. Are there medications used in the operating room?
Oh, we use a lot of medicines in the operating room, and safety for that, a lot of the safety with that is, again, verification. Verification with what the patient's allergic to, verification with what the order is, verification that we have the medication that was ordered. We give antibiotics before surgery, during surgery, so there's a safety with that, making sure that the patient's not allergic to something that we're going to give. We also use some medications in the surgery, we call it local anesthetics, that the doctor will inject during surgery, and there are different types of those that can be used. And there are different concentrations that they come in, and we have to verify those also, so that we're not giving it too high of a concentration. We're doing what's best for the patient without causing any harm, because nobody wants to cause harm. And we verify those with a doctor's order to the surgery nurse. The surgery nurse gets the medication, and then we'll give it to the surgery tech that puts it in a container on the field. And one of the things that we do after we verify that it's the right stuff is that we're going to verify that it's not expired, and then we're going to label the container that's there also, so that if you have a container of normal saline and you have a container of medication, you know which is which before it's administered to a patient.
How are you assured that your patient remains on the table? Are there any safety issues with positioning?
Oh, absolutely, and that's a very good question. Different procedures have different positioning devices that we use, but one standard is that we have a patient safety string, and that's just like a seatbelt in the car. And we put that on when the patient gets on the table to begin with, and that's something that we explain to them. This is for your safety, So, and when they're waking up, that stays on them until everybody's ready for the patient to move to the next table to go to the next phase of care.
Okay. Well, we learned a lot today about patient safety in the operating room, things that we didn't really realize before today. So I'd like to thank you for taking your time to spend with us
Well,
today.
thank you. Thank you, Michelle. Thank you for inviting me.